My name is Kim Simington. I am a resident of New Jersey. We have a retirement home in Sarasota, Florida, which led me to become a local support leader in Sarasota. In August of 2010, I was diagnosed with an acoustic neuroma. My local ENT believed me when he told me that physically my ear looked fine, my hearing test was fine, but I told him that at 52, I can tell you something's not right and I'm not fine. And thanks to him, he believed me and he sent me for an MRI. After I was diagnosed with my acoustic neuroma, I did seek the opinion of a local neurosurgeon. My ENT told me to, he gave me 2 references, asked me to see the first one that could see me. That surgeon was quite frank with me and told me that my tumor was not close enough to my brain. So he referred me to Thomas Jefferson in Philadelphia. At first, my anxiety and my fear was of being diagnosed with an acoustic neuroma was I had never ever had a health issue, never had spent a day in the hospital, actually not even in an emergency room. So to have this be the first diagnosis and health issue that I ever had, I really did have a lot of anxiety. So today I'm doing very well. I ultimately chose 6 months after diagnosis to have middle fossa surgery with the team of John Golfinos and Thomas Rowland at NYU Langone Medical Center. I chose middle fossa because I had very good hearing. At my diagnosis, my hearing wasn't even affected. And that was ultimately what I wanted, was to save my hearing. During my recovery, the things that helped me the most was having a positive attitude, listening to my body. My husband was my best caregiver, and even though I was trying not to give in to what my body was ultimately telling me, that it was time to take a nap, I would lay down, and 3 hours later, I would wake up when I didn't even think that I was tired. My quality of life today, I think, after 5 years of being my best own advocate, I think I'm the best that I can be, and possibly even better than what I was before, because this diagnosis has brought so many wonderful, not only medical professionals into my life, but also many patients. It's taught me what's important in life. It has taught me to take care of myself, self-care, be my own advocate, knowing which medical professional is the right one for me. I was so full of gratitude for my outcome that I always want to help people. I always want to volunteer. I'm volunteering with patients now. I go to local support groups just to give patients hope that, you can get through this. Recently, this spring, was nominated to be part of the national board, and I'm very honored to have been chosen to volunteer for the National Acoustic Neuroma Board. I had some affirmations shared with me. One was, I am strong, and I had a little picture when I wasn't feeling so strong, and I would say, I am strong. So I saw this little plaque, and it said, let your faith be bigger than your fear. Let your faith, whether it be religious faith, faith in your team's skills, let your faith be bigger than your fear.